Loose. Got that shoulder. Let it go.
So head down like this. Hang on 1 second before you get down on that though.
Hey everybody, this is Dr. Warren here at Kalkstein Chiropractic. I'm a chiropractor. We're in Towson, Maryland, near Baltimore. And we're doing YouTube videos sharing with some of the modalities and therapies that we do, as well as giving patients a chance to kind of talk about their experience with chiropractic, some of the movement that we provide here, and the modalities that we also provide. So, Zach, we go back only about a year and a half relative to care and treatment in the office. Mm-hmm. But you've been seeing my dad for a little while. My father's also a chiropractor in this office. You mentioned the White House.
Yes.
So White House is on Pennsylvania Avenue. I was this is a quick little short story, and I'll let you share yours. I was a sophomore in college at Towson University, and I was out way too late. And there was a local Towson kid that my best friend's older brother was in Towson. He was always hanging around, and he called me. He said, "Your dad's office is on fire." And I was like, "What? What are you talking about?" So I called my dad. He's working like a dog back then, like just only by him. You probably watched him go from room to room, just working hard. Had four kids in college around that time too, so he was busy still. And so he answers the phone in the middle of the night, and I said, "Dad, the office is burning down." He's like, "What?" So we meet there in the middle of the night, 3 in the morning. Someone had burned down the dentist portion of the office, and it caught fire to the whole building, if you will. And it was an act of arson in Towson in general. So we met with the firefighters. It was crazy, but that house was the original house where Dr. Adolph started practicing. Back in the early 1960s, 70s, if you will. So a lot of history there.
Yeah, but I don't think he was there when, I think Dr. Adolph was gone when I first started seeing your dad.
So maybe the late, mid-90s, you started to come in to see us, and your grandmother worked with my father back in the day as well, right?
I didn't know that.
Mrs. Law was...
Yeah, you know what? Way back when. I think you're right, actually.
Laurie?
Yeah.
Okay, so way back when. And so you came and said, what did you come over to see us first in the first place? How did you find us, if you will?
My older sister, actually. She was like, go check out your chiropractor. I was having some problems with my knees.
Okay.
And she said, go over there, he'll adjust them, make them all feel better. And I went there for like 6 months, and my knees started to do better. And then I kind of fell off the grid for a little while, and then I started coming back here, and I've been getting treatment on my knees, my feet. He's cured my feet almost completely.
Yeah.
And now he's going to work some magic on my hip.
Happy to do so. Yeah. So I saw Zach maybe about a year ago for some lower back issues and hip and knee related pain. We got into a little bit more movement based practice. He was doing some functional strength program with us, and then he came back in recently with foot pain, right? And plantar fasciitis was his diagnosis. He'd been. Have you seen anybody prior to this for the foot pain? Have you seen any podiatrist? Anybody in that?
You were the first place I came.
All right. Not always the case. We had a relationship with him before, but relative to what we're doing in here, we are doing soft tissue work, adjustments, and then therapy to the bottom of the foot. I'll go into a little bit more detail on some of the modalities of shockwave, dry needling, and laser. Those three things together, when I have access to all those tools, do wonders for soft tissue injury. So for plantar fasciitis, it's like our gold standard for it. So let me show you how I adjust Zach, how I look at him from a motion standpoint, and how I adjust his spine. And then I'm going to take you over there and show you how we treat his feet. Okay? So Zach, I'm going to have you come over on the table. We'll go face down. We're going to start with your low back and your hip. Most of the pain around here?
Yeah, right there.
Try to relax on it. So my wife, she likes kava. She likes kind of like the sparkly when she's not pregnant, which has not been the case for the last like 4 years of our lives. So that's not the case. And then, but if I'm gonna have anything, I'm gonna have a margarita or some tequila. And he's been my go-to guy over at Total Wine when he is working there for information regarding that. And I need to go see you over there, man.
I'm there every Saturday.
There's only one Total Wine here in Maryland. Two of them. That's about the length of my Spanish right there. Hopefully soon to change. So relative just from a spinal standpoint and some joint palpation, I'm palpating Zach's mid-back and low back. I'm looking for direction and moving him according to what I feel from a joint restriction standpoint. Relax here. My Spanish is gonna definitely get challenged here in the next year. Loose, good. We just committed to an au pair who's gonna be living with us over the next year. So I'm excited for Issa to come join us and hopefully our kids get exposed to a new language. Loose, easy. Well, they will get exposed. Hopefully they pick up some of the language. And then this is, I've been talking about it for a while. I've been practicing here and there when I travel, but nothing to have it like it would be at home. So I'm excited to see how that either helps or maybe hurts me. Maybe it makes
You
me
want a
better.
story? I used to speak fluent Spanish.
Did you?
And then I didn't have anybody to practice with. I got almost all of it.
I'll
I
practice.
took 5 years. I took a year in middle school and 4 years in high school.
Mm-hmm.
And I just
Did you travel with it at all?
Nope.
Oh man, so you were fluent just on your own merit?
Yep.
See, that's hard.
I can
probably.
write too.
Could you?
No, I probably don't think I could remember.
Take a breath in. Easy, loose. Good. Drop that shoulder. Good. On your back one. That's impressive, man. So you never try to get it back?
Oh, I'm pretty sure if I started to, I would get it back quickly, but I just haven't. I should, though. They got this program called Babbel. It's pretty good.
Is that where you connect with the Spanish speaker elsewhere? You can do like lessons one-on-one?
I think it does do that. They also have a individual learning, like almost like a textbook, but you speak to the computer.
Mm-hmm.
But they do have programs where you can actually find a native speaker, and that's the hard part because you find someone who learns from a textbook.
Mm-hmm.
It's not the same thing as speaking natively.
No. Yeah, we had a friend that moved. She like heard of woofing before, working on organic farms.
Okay.
It's an organization, right? And I found it through, I was in New Zealand trying to find a place to save some money and live, but also work. And it's a really nice way to travel. You can find like, you get housing, you get food, and you have to work X amount of hours in a week.
That's not bad.
So she goes down there to Argentina to do that. She ends up marrying the guy that she was working for. So she's down there full time. And we did some virtual lessons. It was good.
Learning from a native speaker is actually one of the best things you could do.
Does that pull on that area a little bit?
It actually pulls here.
In the groin?
Yeah.
Just relax. Here.
I'm like right here.
On your head.
That's where I feel it.
Take your knee across your chest. Yeah, like that. And relax. Loose. Let it go. Bend your knee. So, long story short, I'm treating Zach's low back, his hip, both of his feet, and his knees. And so when I'm working on him, I'm looking at all those areas. And a lot of times, even if it's just like an ankle, even if it was just a foot problem, I want to, from a biomechanics standpoint, I want to try to see if I can influence other areas along the chain. So, for a couple of reasons, it's all connected. A lot of times there's other culprits than where the area of the pain is, if you will. And I want to try to make as much of a sensory input around the region as I can, and that can be helpful from a pain standpoint too. Loose. Good. A little movement here, okay?
Okay.
Let it go. Good. So, that shoulders, neck, everything feeling okay there? Yes, sir. Okay. Hey everybody, welcome back. I'm going to be doing the dry needling now for Zach, calf and heel. And so plantar fasciitis is irritation to the fascia that helps support the arch of the foot, okay? And a lot of things that we do day to day can aggravate that tissue. Come on over here, Carly, get a little closer. I'm always looking at the calf. I'm always looking at asymmetries between the pelvis and the hips to see if one foot or heel is striking more, or they're just using one side of their body a little bit more. You can kind of check yourself every once in a while you're standing and be like, I'm leaning out on my right foot way more than my left. And sometimes there's some things going on in the back that can contribute towards that, right? So biomechanically, looking at the low back, the calf, looking at the heel. And then relative to dry needling, I'm going to treat the tissue locally where it's irritated and where there's the pain or the shortened tissue, and where there's where I want to cause some of that effect, if you will, with the needle. So in plantar fasciitis cases, it could be on the fascia itself. You can kind of see it pop out right here. This is the edge of it, and you can see the lines of it. It's a very superficial to the rest of the foot kind of makeup. A lot of the muscles, tissues, ligaments are deep to that. So it's pretty high up, if you will, in the levels. And then it attaches right here to the calcaneus. And then I'm going to look into the calf relative to trigger points, restrictions, and the gastroc soleus and posterior tib. He doesn't have much complaint as it relates to the Achilles tendon, so I don't need to do a ton of work there. But he does complain about some lateral heel pain. So relative to some of the tissue work that we're going to do here, this is the result of a problem. This is where the pain is. So I am definitely going to treat locally here because this is where he's hurting. But my goal and my focus is more lower extremity and core as it relates to what I want to try to change over the course of time. So I'm going to work this area. He's doing a lot better. Like he said, he's feeling a lot better. He's moving better too in this area. Sorry, sensitive in the foot, but you know, just kind of a couple moments of a little discomfort, and then it's really worth it, especially when you're dealing with chronic heel and calf pain. It's the worst, especially at the end of the day. Plantar fasciitis, stiff in the morning, gets better and then gets worse, is usually kind of the role that it goes through. Feels like, you said that's exactly what happens? Yeah. Pressure.
So head down like this, and 1 second before you get down on that though.
What's the difference between dry needling and acupuncture? You were thinking maybe? Or I get asked like every time we do a dry needling video. Same tool, very similar. Different lengths of the same tool. What we're using right now, you're seeing a 1-inch dry needle. Really skinny, small needle. It's pushing, it's not cutting through tissue. It's a stimulus I'm trying to create locally. I'm trying to stir in a little bit of an inflammatory response locally so that the body brings all those good things that come when we're injured. So I'm hijacking the body systems, if you will, that way. There's a mechanical release of tension locally to fascia, and a stimulus to the nervous system to also release tension in trigger points or in tissues themselves. Blood flow is like kind of a loose term a lot of people use when they're treating an injury. There's a lot of physiological changes happening locally here as well as in the cortex that help with pain. But acupuncture is going to be a little bit more just different language, different textbook, if you will, to what happens in the body. So they use energy or chi, they use lines and meridians, they're stimulating or not stimulating a tissue or an energy. There is, think like this is muscle, joint, local problem. Acupuncture be treating like asthma or different systems in the body, and there's different elements along those chains of energy, and they're trying to stimulate it. There's a lot of correlations between different lines, so it's a totally different approach. It's a type of medicine in its own right, if you will, traditional Chinese medicine. And now I'm treating his gastroc. There's two major heads there that I'm going up, and this lateral belly is definitely hanging out with a little bit more tension in here. You might feel a little jump here, buddy. Good. How you doing up there, Zach?
not to flinch.
You're doing pretty good. No flinching over here.
Oh no.
We are impressed.
Thank you.
So you can kind of visualize that.
Yeah.
Do you eat it like corn?
Well, maybe a replay from Kiro if he's really feeling creative over there. You can see the trigger point jump if Carly picked it up. That's good. All right. Locally, where he's got his pain, we're treating the plantar fascia on the insertion site, and a little bit of the medial heel pain he's got. I'm treating this tight band of fascia and tissue in the gastroc, and then I'm going to work on his lateral hip. He's got a little bit of like a trigger point in his hip, and I palpate in his glute med, so I'm going to treat that. And once we're finished that, we'll pull, and we'll show you some other modalities as it relates to helping out, like complement this therapy a ton, which I love. Cool.
I was just trying to figure out what head I was going to use on you, because we've got a couple different heads that'll kind of send the shockwave a little deeper. I think I've got a good idea for you. I'm going to end up going for the gold one. The gold one will get a little bit deeper, especially on these heels. That'll be a good spot. And I'll go ahead and hit both of the heels for you as well, okay? Let me go ahead and get your settings right. And just like they did last time, I'm going to go ahead and start a little bit lower for you, just so we can kind of find what's a comfortable level, and then from there we'll kind of increase it. What we're aiming for ideally is like a 6 out of 10 on a pain scale, okay? So what I'm doing now is I'm just going to start with a little bit of vibration therapy, just to kind of wake up the calves, not only to help spread out the gel that I put onto the heels to make the shockwave itself a little bit more comfortable, but also to just kind of send a little bit of minor vibrations into the calf and really just wake up the muscle, just to open it up a little bit more for those cells that we're going to be trying to essentially take out here in a second. What we're doing with the shock therapy, once we get onto the radio pulse, is we're actually trying to basically blast the muscle to target any dead cells or any unhealthy cells, any cells that really don't have any business in still being in that muscle, and we're essentially trying to kill them. Now what that's going to do is jumpstart the healing process, so that way the body can say, hey, we've got to replace these cells in the muscle, and again, really kind of just overall jumpstarting that healing process. For whatever reason the body might be going a little bit slow with. So now that we've got the calves nice and covered, we're going to go ahead and turn off the vibration therapy real quick. We're going to stop treatment, and we're going to switch it over now to that radio pulse. So just give me 1 second. I'm going to clean off our gel. And so like I said, I'm going to just start you off a little bit lower, and we're looking for that nice 6 out of 10 pain scale. Alright, Zach? Sounds a lot more intimidating than it actually does feel. So how does that feel right now, Zach, for you intensity-wise? Pretty light? Pretty babyish? Perfect. Crank that bad boy up some. So what we're doing is we're raising the pressure right here. And again, we want to ask constantly, where are you at, Zach, with pain level on a scale to 10? Maybe a 2 out of 3? Pretty light still? Good. So we're going to just constantly be asking that until we ultimately find either a sweet spot where they really can't handle the pressure, or until we just overall get a nice 6 out of 10 level. So Zach, are we approaching maybe about a 3 out of 10 right now? Perfect. So you got any plans for the weekend, Zach? You're doing what? Oh, nice. I didn't even know we had a Renaissance Fest coming up. I'm going to do the Italian Food Fest this weekend. It's right there in downtown in Little Italy. So where are we at on intensity right now? 4? Go ahead and turn it up. And I think probably about right here is where that... Are we at a 5 or 6 or so? Perfect. So this is ultimately where we're going to be. And now again, the calf is a pretty thick muscle, so you're going to have some patients who can take a little bit more of a beating, but Zach here, he can definitely take it out, because He is at 4.5 on the bar pressure out of a 5 scale, so he can definitely take a little bit of a beating on these heels. So again, we're basically just looking for any sweet spots, any spots that we kind of see, you know, any sort of reaction from Zach or if Zach ends up, you know, giving us any sort of a notification like, ooh, right there is pretty bad. But all in all, for him, we're just circling the entirety of his heel. And we're going to do this again with this other foot as well, but we're just going to try to make sure that we get as many pulses into that plantar fascia muscle as we can. Now, a common question that we end up getting with the shockwave therapy is, you know, after this therapy, should I end up using ice? Should I end up using heat? You know, what is best for me to do at the house on my own? And contrary to what you would immediately assume, heat is actually going to be the best thing to use after this, because what we're trying to do is actually bringing in inflammation into the muscle. So if we end up using ice, we're going to essentially take away all of that inflammation, and that's not what we want. So if you want to do anything after, it's definitely going to be heat over ice.
Counting down the pulses, that's crazy.
Yeah. And so essentially what it's doing with the frequencies here, we can basically tell if you see the pulses, that's how many times it's making contact with the muscle. But that frequency, we can tell it, are you delivering little tiny fast jabs to the muscle, or are you just every so often big punches? So we can, you know, not only tell it to go faster, or we can tell it, hey, don't go really fast, but every single time, really big punch into there. So again, that would kind of speed up or slow down the treatment based on what you're trying to actually give to the muscle.